When COVID-19 threatened our communities, Pennsylvania hospitals stepped up as leaders. Healthcare teams put their own well-being at risk to care for Pennsylvanians. They developed treatments to push back against the novel disease. They used their trusted voices to educate their communities. They saved lives. But their leadership didn't end there. As champions for public health, hospital teams worked closely with their communities to meet local needs. They found unique solutions to address the pandemic's unique challenges. They stepped beyond the role of frontline caregivers to confront issues like vaccine access, supply chain disruptions, and health disparities. HAP's COVID Response Innovation Awards recognize the innovative teams, solutions, and projects that have helped shape the healthcare community's response to, understanding of, and resilience to the COVID-19 pandemic. Nearly 80 projects were evaluated by an independent panel of judges. Let's meet the award winners. When life-saving COVID-19 vaccines became available, racial disparities in access were evident as white people were vaccinated at much higher rates than Black people. Penn Medicine and Trinity Health Mid-Atlantic partnered to address these racial inequities in vaccine access to earn the third place award. Collaborating with community leaders to reduce racial barriers, the Healthsystems established rotating clinics in the heart of Black neighborhoods with a low-tech sign-up process to bridge the digital divide. During March 2021, the Penn Medicine and Trinity Health teams vaccinated nearly 3,000 people, 85% of whom were Black. The joint effort ultimately administered 60,000 vaccine doses across the larger Philadelphia region. Supply chain disruptions early in the pandemic made it difficult for hospitals to access the equipment needed to protect the healthcare professionals caring for patients with COVID-19. The second place award goes to Allegheny Health Network for 2 projects. Its innovative solution to address N95 mask shortages and its efforts to vaccinate people throughout Western Pennsylvania. AHN's team of clinicians and supply chain leaders developed a strategy for sterilizing industrial respirators so that they could be adapted for healthcare settings and reused. The system reduced the number of N95s needed by 95%, resulting in both a cost savings and better protection for frontline workers. AHN's Team Vaccine staged mass vaccination events that delivered more than 400,000 vaccine doses to more than 200,000 people. The health system put a special emphasis on ensuring access for historically underserved and marginalized communities by partnering with local churches, community organizations, homeless shelters, and jails to set up vaccine events. The closure of schools during the pandemic created growing challenges in children's mental health and academic readiness. The first place award goes to Children's Hospital of Philadelphia for its vaccination campaign focused on protecting the well-being of Philadelphia children by helping schools return safely to in-person instruction. Collaborating with city and school leaders, the hospital mobilized resources to administer 38,000 vaccine doses at convenient pop-up clinics across the city. Hundreds of CHOP employees volunteered their time to greet, register, vaccinate, and observe the Philadelphia school community. The team vaccinated more than 19,000 teachers, school staff, and childcare providers over 6 weeks, helping to protect the health and well-being of Philadelphia children and their educators. Congratulations to all of the award winners, and thank you to Pennsylvania's entire hospital community for your dedication to protecting the health of our communities.